Hi, and welcome to episode 311 of the Untethered podcast. Today, we have Dr. Hilary Fritsch joining us. Dr. Fritsch is a leading airway and biological dentist, one of the very few in the country with deep expertise in proper jaw development and airway health. She's also Montana's premier tooth pillow provider, offering cutting-edge non-surgical techniques to optimize airway growth and function. Practicing dentistry since 2006, Dr. Fritsch has been featured on The Today Show, New York Magazine, Business Insider, Pop Sugar, Fatherly, and Romper. Her passion for wellness is deeply personal, shaped by her own struggles with childhood sleep apnea and a debilitating autoimmune disease that once impaired her ability to see and even walk unassisted. These experiences fuel her commitment to helping patients and their families optimize the health through airway-focused dentistry. Dr. Fritsch is the founder of Western Sleep Solutions and Saddle Peak Dental, both rooted in the philosophy that oral health is intricately connected to whole body health. She specializes in non-surgical airway development and the treatment of sleep apnea, breathing disorders, and orthodontic issues that impact long-term wellness. Determined to bring the best possible care to her patients, Dr. Fritsch has trained under one of the most elite airway dentists in the world and continuously pursues advanced education in airway-aware orthodontics, occlusion, and oral microbiome health. She's an active member of the International Academy of Sleep and other leading organizations dedicated to uncovering the root causes of airway dysfunction. Dr. Fritsch is passionate about educating and empowering her patients, both young and old, to take ownership of their health, breathing, and longevity.
Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started.
Hilary, welcome to the podcast.
Thank you for having me, Hallie.
I'm excited that we finally are doing this. It's been a long time coming.
Yeah, well, two busy moms. It's hard to find a day.
Yes, for sure. So I'm excited because I've been following you now for a while on Instagram, and you're just such a wealth of knowledge. So before we jump in and talk about, all things airway, myo, expansion, whatever, wherever this goes, I would love for you to start by sharing with everybody just how, a bit about your background and how you got into the airway space.
Yeah, so I've always been a mouth breather. Like as a kid, I think I had sleep apnea. When I look back, I had like all the classic bedwetting too late, dark circles under my eyes, chronic headaches and stomach aches, earaches, throat infections, all the things, chronic sinus congestion, runny nose, allergies, and poor facial development, crowded teeth. And it like runs in my family. We're like 2 generations in of no breastfeeding now. So yeah. And then I think I started to wake up to how airway was related to dentistry and had some patients that were looking for help and started taking a course here and there, and then realized that I was like needing to learn all about airway so that I could help myself. Because I had sinus surgery 10 years ago and it totally relapsed. So I was like, this isn't the answer. I got to keep going and to help my kids. And it's just like, for me, it's like way more fulfilling than drilling teeth. I feel like I've done 20 years of that. And I'm just really interested in helping people develop their faces and their airways so much more. And I started to like just kind of keep tiptoeing and taking more courses and finding the best mentors. And like, and it just kept evolving. And I feel like I'm finally like found my passion with this. Like I've always liked dentistry, but this is just so fun and fulfilling. And so it was just like a natural evolution. I also had an autoimmune disease that was really, really bad. So I went through this whole process of trying to heal myself without doing traditional Western medicine, just like injections and steroids and all of that. And so I kind of went down this biological pathway, and the biological and airway dentistry is sort of intertwined because it's a really root cause approach. So as I like sort of shed my traditional dentistry and Western medicine belief system and started to kind of step into my own path, it all like fell into line together.
Yeah. Yeah, I like that you brought up the biological dentistry side of things because I've told a lot of therapists who are like, how do I find a dentist in my area that, maybe they're not doing this yet, but they're at least open to learning. Maybe they'll learn alongside me. And I've encouraged them to go find a biological dentist because I'm like, they already think differently. And so they may be more open. And it just so happened that one of my closest friends growing up, I had no idea. I knew she was a dentist. I had no idea because we kind of moved apart a little bit in college and grad school years. And all of a sudden we're now married with kids and, chatting here and there, but had no idea that she was a biological dentist. I just knew she did dentistry. And so when I discovered that, she and I went and sat in a tongue tie course together and then both started like diving deeper and deeper into this airway space. And so now she's like one of our primary referral sources where my practice is up in the DC metro area. But it was such a wild ride. And I mean, I always tell people, I'm like, you have no idea unless you ask somebody because it's not always well documented. I mean, her website's great, but I'm like a lot of websites, it's not well documented on. Like I'll find these dentists that have now gone down this rabbit hole, but their websites don't always even reflect it. So yeah, biological dentistry,
It's some good stuff. I think it's like it's the future of dentistry, in my opinion. Like everybody will start to move in that direction as patients kind of force the issue. And as like more and more research comes out, like, we're talking a lot about fluoride now and how it's a known neurotoxin. And as more and more dentists embrace that reality, we will have more and more biological dentists because it's kind of like that rabbit hole. You take this one thing and you're like, well, what else is wrong? What else were we taught?
yeah.
So biological dentists are sort of hard to find. There's not a ton of us, but I would just say like Google biological dentist in your area and kind of check out their website. You can look at IAOMT. They have a like a reference, but you have to pay to be on that. So not everyone does it. So it's more like kind of word of mouth and hunting on the internet. And I would say just like for airway dentistry, for biological dentistry, it's worth traveling for. The failing root canal problem is like the biggest story, I think, in biological dentistry, because there are so many people walking around with a root canal that's just leaking nasty bacteria into their bloodstream and their jaws, and they feel nothing. So they don't realize. And if you don't take a CT scan of it, you can't tell that there's all that bone loss. And general dentists have become normalized to like seeing some bone loss around an old root canal. So we kind of like looked the other way for 20 years. And I just think there's a hidden epidemic of immune issues that come from your body having to deal with that, all those nasties getting into the bloodstream every day. So I think that's also like going to become more normalized conversation, and the kind of dentistry that people are looking for is someone who's opened their eyes to that. So that'll be evolving alongside the fluoride issue and the toxins issue that we deal with in dentistry. There's mercury, all of that.
Yeah. I feel like I'm hearing more and more, and it's probably just because I'm following all these holistic people on Instagram, but more and more conversations and stories around people who actually fell into the more holistic space because of dental issues and because of, like you said, it was a failed root canal or just autoimmune diseases, things that have been diagnosed, and then they've been able to somehow tie it back to like dental work they had or an issue, dentistry wise, that's been going on for years.
Yeah. Just in the last year, I have a handful of patients with a story about a little mercury filling that was creating severe depression and anxiety.
Wow.
And like, I kind of can't even believe it myself. I'm like, you really feel that different after we took that filling out? And they're like, yes, like my whole world changed. And so I just think our toxic cups are full, and like, we have to be looking at all of the things that are contributing to so dentistry is like so obvious, it's been detached. Like we act like this thing that's happening in your mouth is so separate from the rest of your body. And airway dentistry is the same. Like people are really trying to wrap their brains around like, so sleep apnea is a jaw development issue. But if you can start to think that way, that the mouth is not isolated from everything else, and if you had this giant gaping infection on your hand, you'd do something about it. But because it's in your mouth, like it's hidden, and I don't know.
Wild.
We're getting there. I'm really excited that it's like social media is weirdly like very effective tool for awakening people on this stuff.
It really is. It really is. And I mean, I feel like when I started my account back in summer of 2019 and I started this podcast back then, I was like, nobody's talking about this on a podcast. I was like, I'm not even the expert, but I feel like I know enough people and I'm bold enough to go out and ask enough people to like, hey, come be a guest on my podcast and share your knowledge. And so it was sort of like partially self-serving, but then also like, I know a lot of other people want access to this information, right? So I started the podcast. And it's been cool because I feel like I've seen the evolution like slowly over the past 5 years or so where, there's more and more people who have fallen in, if you will, into like this space, right? The dentists and orthos even and speech pathologists and the registered dental hygienists and OTs and PTs and now chiropractic. And it's just very interesting to see because like the one thing that you mentioned that just holds so true is like we talk in other spaces about how like our mouth is basically our window into our health. Like they talk about it when it comes to Alzheimer's, right? So why is it so unbelievable that it could be causing all these other health issues? I just feel like people are surprised.
Yeah, I think we just have to change the narrative. Like it's been kind of this isolated issue for so long, and like little by little people are starting to think of it differently.
Yeah. Yeah. Now, the other thing you mentioned too, so you had like your experience with sinus surgery 10 years ago and all that fun stuff. In my experience, mine wasn't sinus surgery, but I had nasal surgery. And this was now, I think it was 2022. So almost 3 years ago. April will be 3 years. And I had done tongue tie release, adult expansion, myo. I had expansion and braces as a kid. I had permanent retainers behind my upper and lower teeth that were removed. I asked for them to be removed when I turned 30, so almost 10 years ago. And everything started to immediately shift. And when I said something to my dentist, he was like, no, you're fine. I'm like, no, my bottom teeth are turning. I see it. Like I'm a little vain. Like, I don't want that to happen.
Yeah.
And he was kind of like, it's fine. Everything's fine. And well, went into adult expansion, worked on straightening things out. Anyways, all that to say, I feel like I did things almost in the wrong order because then 3 years ago, I had nasal surgery. I had my septum fixed. It was turned kind of, towards the back left, more posteriorly. I had like a bump on my nose from pregnancy, which I had like shaved down. I ended up having a rhinoplasty at the same time. So I was like, I know this can be an open procedure, but let's just, put me under, do the whole thing.
Yeah.
I was like, I don't need a skinny little like fake looking nose. I just want a straight one without the big bump on it now.
Yeah.
Because sleep apnea definitely is more pronounced in pregnancy for some women that have airway issues. That was me. And then my nasal turbinates were reduced and I had nasal swell bodies reduced, which I had never even heard of before. But I was like, oh, so we got things growing from the inside out, from the outside in, like, and I really can't breathe out of the left side of my left nostril at all. Cool. Which was interesting because I was years into this space already and had no idea that my nasal breathing was that impacted until I had the scans done and some home sleep tests and all that. And I presented as like your UARS, right? Upper airway restrictive syndrome. Did not present like somebody with sleep apnea. So most normal people would just ignore me in the medicine world, right? And so it's like, you're fine. And anyways, we knew I wasn't fine. I was never entering REM sleep. Like every time I would start to enter, I would just jolt right out of it, but never actually come fully awake. So I wasn't having these like major arousals that like, or gasping for air type of moments. But anyways, very fascinating. It did improve after the nasal surgery, but now I've been like, and I don't know if you have opinions on this, but now I've been looking into like, what else do I need to do? Do I have enough space? Because my tongue is generally up, but I'll find myself, sometimes biting my tongue, pushing it between my teeth, upper, lower. And like, yeah, there is enough room in my upper jaw for my tongue technically to rest, but when fully at rest, it seems to spill over. So I like the whole MARPE discussion. I don't know if you have like thoughts or opinions on like MARPE and all that, but because
is that what you did?
I did not. No, I did not do it. I
How'd
know
you
in
do
ortho,
expansion?
huh?
So how did you do expansion?
I use the DNA Vivos appliance
Oh,
upper and
okay.
lower. Yeah. And I liked it. It was really bulky. I'm a good patient, but I'm not the best patient because I can't wear it 16 hours a day or
Yeah.
14 hours or whatever they wanted me to do. I'm a speech pathologist. I'm working, right? So I would put it in at night and maybe get it 8 hours a day out of it, like while sleeping, basically. And so it took me 2 years to go through that, 2.5 years. I also noticed about halfway through, my body was like locking up. So I was working with a PT who was like, PRI trained and did some other counter strain type of stuff. And I would notice like he was in their office too. So I would see him there and between my dental appointments. And I would notice my body would release and I could crank the appliance further after I saw him. So that was really cool. So I liked it. I don't know that I'm willing to go through that whole thing again because afterwards I did Invisalign and apparently the last couple trays of Invisalign will kind of retract you a bit. And so I think I actually ended up retracting myself
Well, only if they
unknowingly.
are. Did your airway dentist design your Invisalign?
They did. But I feel like there was some education around that like was coming out at that same time
Yeah.
where people were like, oh, because this was like, I don't know,
You did
2018-ish.
this a while ago. Yeah.
Yeah, like I think people were like, "Oh, don't do the last 2 to 3 trays, of the Invisalign or something." And
Yeah.
I was like, "I just finished that." Thanks
You're
for that
like,
information.
well, you could go in reverse and like wear them backwards. But I mean, I don't find that to be the case with my clear aligners, but
Yeah.
I do think I don't use Invisalign anymore. I don't like that product as much.
Okay.
But also like this field is evolving so quickly. Like
Yeah.
2018 was a different story than right now,
Yeah.
But
Yeah. Do you
so
like Marpy or no?
I don't do Marpy.
No.
I do Vivos.
Okay.
And I've been seeing lately like a lot of scary Marpy cases where I'm like, oh
Mm,
God, like they either went too far or there's a lot of asymmetries in the expansion.
interesting. Pediatrics and adult or like more adult that you're seeing like
The
scary?
adults, I feel like the
Yeah.
kids like expand nicely.
Yeah.
I don't really feel like we're seeing a lot of asymmetries in kids.
Okay.
Um,
Interesting. Because I have that asymmetry right now where like my maxilla is turned in on the left side a little
uh-huh.
bit. And it's been like that for years. So that's where I was kind of like, do I need to actually like, do I need to split down the suture or do I need to like change something? Because doesn't align.
Your midlines are off, you mean?
Mm-hmm. And it's not
Yeah.
we used to think it was the lower jaw. And then we
Yeah.
realized it's not, it's actually my maxilla and it's more turned in on the left side. Because you can
Okay.
see.
Yeah, like it's not doesn't line up with your nose.
Mhm. Yeah. Anyways,
Yeah.
but I don't know that I'm even a candidate for Marpy. So it was a discussion we had, and then they were like, "I don't," because of the nose job. They were like, "Because of the rhinoplasty,
Uh-huh.
your nose will probably like." I think there's a concern that it would collapse with
Oh.
splitting the suture of the palate. So
Yeah.
I'm like, "Well, that's off the table now."
Well, imagine trying to do your job with a Marpy in.
Right?
I mean,
Well,
that's the
yeah,
other thing is I was like, this feels like I wouldn't want to do that myself. I like
yeah,
the non-surgical approach of Vivos.
yeah.
I like that you can take it off and talk normally.
Mm-hmm.
I think it's
Same.
gentler. So it's a little bit less invasive and potentially less risky.
Yeah.
But I don't know. I don't like worry too much about midlines, but I'm talking
Yeah.
like major facial asymmetries where we saw this
Mm,
side go and this one didn't.
got it.
Or like the jaw, just the asymmetries of the jaw are like noticeable with the lips closed.
Mm-hmm.
I think some people are moving their Marpy too fast, maybe, but I'm not a Marpy expert, but that seems to be like what's happening
Yeah.
because you
Yeah.
can get changes pretty quickly with that thing.
Yeah. So, okay, so you use the Vivos DNA. What do you do afterwards? Because like after mine, I had all these gaps, and obviously, it's like I mean, for vanity purposes, some people want to close those gaps, right?
Yeah,
So
for
that we don't
sure.
have big gaps between our teeth. But also, you do kind of retract in closing some of those open spaces, don't
Well,
you?
you don't
Or
have to.
no?
So
Okay.
I use candid clear aligners and we just like move the teeth together.
Okay.
So ideally, no retraction. In fact, we can even get more expansion with the clear aligners if we want. Clear aligners are not going to remodel the palate.
Right.
So if we want to remodel the palate or improve cheekbones, then and like get more forward growth, I'm going to use the DNA
Yeah.
or the mRNA or a Vivos device. But if we just need to make the mouth, if the patient can breathe through their nose really well and we just need to make the mouth bigger because we need to improve the tongue space,
Mm-hmm.
I always tell patients, like, picture your mouth as the garage for your tongue. If the garage is too small, it's going to be hanging back in the airway. So if all we have to do is just make more room for that tongue, clear aligners work really great. Like, I can make a lot of room with those.
Yeah.
So if your nose is working really well, I would say, and you wanted a little bit more expansion, you would just do clear aligners. But so here's my thing about nose surgeries is a lot of times they're relapsing.
Yeah.
But I think, and there's not really like good research on this yet, but I think potentially what is happening is we're fixing the nose, but we aren't establishing a good nasal breathing habit. And so it's becoming congested again. You know, it's like designed to have airflow going through it all day and all night. And if it doesn't, it's going to become congested again. And, you know, it'll relapse. So I feel like if the patient did myofunctional therapy and use a device or mouth tape or something to ensure that they were mouth breathing all night, maybe we could start preventing the relapses.
Yeah.
What do you think about that?
Yeah. I mean, I totally agree. I think that myo should go hand in hand with expansion,
Yeah.
whether you're just moving teeth or you're saying if you're shifting teeth with like a clear aligners, then you're going to want to have had established nasal patency anyways, right? So
Yeah.
we're talking more like the DNA Vivos type of cases where we're actually expanding bone
Right.
outside of the teeth. Yeah, 100% need to be doing myo. We also like to establish like a nasal hygiene protocol. So I'm kind of curious to know like what your protocol is. And this is sort of for my own kids, I'm wondering, because, when I did my nasal surgery, I started to nasal rinse, right? Because around the procedure, that's what you do.
Mhm.
And I feel like now my kids were like, oh, I want to do that. I want to do that. I was like, okay. So I got them your little kids Neomed nasal rinse bottles. We have it on like auto ship from
Yeah.
Amazon. It comes like every 3 months we get a new bottle and whatever.
Yeah.
And they do it like almost every morning. But now it's been very interesting because like I do feel like if we when we travel, we'll take it too, especially when we're on an airplane. But they sometimes don't do it. And then they'll get sick. So I'm convinced like we should keep doing it. However, then they'll do it. And like my younger one who's 7, she's like, it burns. And I'm like, am I destroying the inner lining of her nose? Like, should I stop doing this?
I mean, that's why I don't use a Neomed because I find that it burns. I feel like I can't get the temperature of the water just right. And I'm always like, dang it, it's too hot. Or, somehow it's my nose is too sensitive to it. I really like that X Clear spray.
Yeah.
It's also just like, easy. Like you don't have to mix anything.
Yes.
And you don't have to clean anything. You just, start a new bottle. But I would say do it before bed because you want to really make sure the nose is nice and open.
Mm-hmm.
I mean, it doesn't hurt to do it in the morning, but I think making sure it's nice and open before bed is really key. I like to do a hot shower, blow your nose, spray the Neomed, the X Clear or Neomed. If you like Neomed, use it.
We have the X Clear too. So we just kind of fell out of using that one. So I'm like, we should probably swap it up.
I feel like they're both good. For me, the X Clear is just really easy.
Yes.
And I mean, like my bedtime routine's already getting kind of long these days. So I'm like, I'll need easy. I'm also not opposed to using Flonase for a short period of time to help. Like, this cold and flu season's been pretty gnarly. Everybody's been stuffed up. So just to like kind of nip things in the bud, but that is a steroid. So I don't want patients using it for a long time, but like 2 weeks of Flonase before bed, blow spray, blow. If you tasted it, you wasted it. That's a pretty good nasal hygiene routine.
Okay.
And I like to do some buteyko breathing exercises right before bed too, to just help open the nose. And so you're like kind of encouraging your body to do everything right,
Yeah. Yeah.
While you're unconscious.
How young do you work with? Do you see like all pediatrics, like through adults?
Oh, I work with all ages, but age 3 is like the beginning of where we can really start doing something.
Yeah.
Before age 3, it's kind of just like counseling mom and dad on some tips,
Yeah.
But age 3, starting with myofunctional therapy and a tooth pillow, I think it should be kind of like the gold standard. Like every kid should get evaluated. Let's make sure they're breathing through their nose. Let's make sure they have good tongue posture. We can prevent all these developmental facial developmental issues if we start really young. So I'm a huge fan of that. As they get older, we do, or depending on how affected their sleep is, we do some fixed expanders, upper and lower fixed expanders, and then clear aligners as needed.
Mm-hmm.
And sometimes back in a tooth pillow, because that's like after the expansion and the nose starts to open, that's great, but we need to now make sure they're using their nose again.
Yeah. So it sounds similar to my kids. So we started when we were up north, we did the ALF on my now 9-year-old, but she was 4 at the time, which was actually amazing. It was also at the beginning. It was overlapped with the pandemic. So that was a little tricky from like a bodywork standpoint. So we did none. Because by the time we were getting into it and I was having we were doing appointments, it was like, oh, no, everything's shut down. But we did start her in August, like right when she turned 4. And she went in 3 months, like her tonsils were gone and they were almost kissing. And so and this was like cold and flu season up north where it gets cold and everyone gets sick. Right. And so I was like, okay, there's something cool going on here. And so she was in it for a year. We got some really beautiful expansion. Her sinuses cleared. I was like, I'm in, I'm all in, I'm sold. And then we moved. When did we move? Like a year later. So maybe a year after she came out of it. But we ended up going to a dentist down in North Miami. And they put her into a Hyrax with like a forward growth component that the dentist created for the appliance to do a little more expansion. She did great. And then they put her into a myo brace afterwards to kind of like hold the expansion, but like she cannot keep that thing in her mouth. Like she has it in, she'll go to sleep with it. She will gag it out like every single night about an hour into sleeping. And I'm like, what gives? So we kind of gave up on that. Whereas my younger one was 4 she was 3 when we moved down here. So at 4, she went straight into the Hyrax because this is a kid who had croup 9 times as a 3-year-old. She'd had it her entire infancy into toddlerhood. They were constantly putting her on steroids every single time. And I was like, something has got to give. This is not healthy for her. Like this poor little inflamed like child at like age 3. So anyways, at 4, initially she was like, let's start her on a myo brace. And then I told her what was going on. She had a really deep bite. She was grinding her teeth down. And she was like, no, we're going to put her straight into rapid because she's kind of in an emergent situation. So she went into the same thing that my older one went into. She did some buildup on her back teeth to prevent her from like continuing to grind down and everything. And then she went into the myo brace afterwards. And she was like a perfect little myo brace wearer at night, would wear it all night long. And then she moved up to the next size. And then all of a sudden there was mold in the appliance. And like we wash this thing every day and we let it sit out and air dry. And I think it was because like a component of it broke inside from her chewing on it, which they want you doing, right?
Yeah.
And I don't know, it somehow poked a little hole in the plastic and mold developed. And I was like mortified. I was like, I bought a new one and then we never wore it again.
Oh.
So I'm like, but I think it kind of reminds me of what you were saying. Cause like the tooth pillow and like the myo brace, the idea of like guiding growth, continued growth now that we have expansion and kind of just supporting the jaws during sleep. Is that kind of the idea behind using tooth pillow after expansion?
Yeah, I like to use it as like a habit forming device after, and it can also work really well for retention. So like after the expansion, we use it to make sure that we're continuing to have that good tongue posture and the jaws in the right place because it helps you posture your mandible forward. And it kind of works like a retainer. So most of the kids who can't really wear it at night and keep it in all night, they need to be wearing it more during the day to get the muscle strong enough to keep it in at night. And typically that gag reflex goes away when we do expansion, but sometimes
I don't know what it is. She doesn't have like a hyper gag reflex normally. So I'm like, I have no idea if like the saliva is just pooling or her tongue's falling back or what's happening.
Well, have you tried mouth tape with her?
I haven't. I think it freaks me out a little bit because of her whole like, coughing it out in the middle of the night. And I'm like afraid to like tape her mouth. So, I mean, I could try it with her during the day. I'm like one of those hesitant providers.
No, I mean, don't use the myo brace and just use just like a myo tape so she can still breathe and move her lips, but it would like encourage her to keep them lips closed. Then I think you kind of check the box. Like if you know she has good tongue posture and she's keeping her lips closed,
Yeah. And I would say my kids both have closed mouth postures when sleeping unless they're sick at this point. So, would you still recommend like trying mouth tape if you feel like the kid's mouth is closed, or you're only doing that for a closed lip?
I'm doing it to just make sure they're keeping their lips closed. So if
Yeah.
you feel confident that they're keeping their lips closed and breathing through their nose, then I don't think you need to do it.
Yeah.
I also like hesitate to recommend it because it's not for everyone.
Right.
It can be dangerous. You
Yeah.
need to know that their nose works.
Yes.
And that they're not overweight, because the weight on the stomach can actually create this hypoxia, but it can be a good tool to ensure that they're nasal breathing,
Yeah.
or see if you're nasal breathing,
Yeah.
besides like setting up an iPad and recording them all night and then watching it back.
Yeah.
So many people think their kids are nasal breathing all night, and I'm like, I know they're not,
Yeah.
or their teeth would not be this crowded, and their soft palate wouldn't be inflamed, and their tonsils wouldn't be like that, so
Yeah.
it is hard to tell. But like, you're in the space, I can, like, if I sleep with my kids, I'll be like, oh yeah, it's kind of different than
I
I thought it was.
admittedly fall asleep in her bed probably 50% of the time because I'm tired, and I'll put
Yeah.
she's the kiddo where it's like she wants us to be like in the bed with her when she's
Yeah.
falling asleep, and it takes her an hour to fall asleep. So,
Yeah.
as she's kind of winding down and we're talking and all of that, and she finally falls asleep, like an hour later, I'll find myself like waking up. And
I know that's so hard, because I'm like, there's no way I'm going to lay down at 8:30 and not fall asleep. Like, I am tired too.
Yep. Welcome to my life. I mean, half the time my husband and I are like, we roll over and like the bed's empty. I'm like, that person is asleep in Lily's bed. Totally fell asleep putting her to sleep. And half the time I'm like, I could get up and walk downstairs to our room, but then I'm going to be fully awake. So I'm just going to roll over and go back to sleep.
Literally happened to me last night. I was like, I'm not getting up because I don't want to be that awake. Like, this is kind of fine. I don't have my favorite body pillow, but like, I'll make it work.
Yep. Oh man, kids, I'll tell you. Okay. No, this is all interesting. So are you, I guess, so in the little ones that you're starting the tooth pillow with, right? How long are they usually staying in the tooth pillow before they might actually go into further expansion, or kids not needing further expansion? Like, what are you seeing from that?
It just depends on each kid. Like, it's 2 years of treatment. And like, if they got mold in it, I would be like, here's a new one, like no big deal. But I feel like it just depends. So sometimes we'll bookend expansion with MyoBrace or Vivo's Guide, or whichever one is the appropriate choice appliance for their bite. To me, that's a really nice way to, like, before the expanders go in, train the tongue to get up there. That way, after the expansion, we kind of like get it back quickly, and then we, it just bookends the process really nicely. But a lot of times, like if we start young enough and the kid isn't too restricted, we can just do a tooth pillow and we don't have to go into expanders. We don't have to do any ortho because the teeth are going to fall into place like they're meant to.
Yeah.
So it's really specific on like what we came into the situation with.
Yeah.
But what the fee is for 2 years.
Okay. Yeah, no, it's all very interesting. It's like thinking back to my kids and the first one who I did the ALF with, I feel like that gentle, slow expansion that she got changed her health, but it also, I think, allowed for her teeth to start falling out because my kids were both late to get their teeth, which I know means they're going to be late to lose their teeth. It's just sort of like this whole, down the pike.
Yeah.
So we kind of, I don't want to say we caught up, but we started to kind of normalize that timeline a little bit more with the expansion.
Yeah.
And, and my younger one too, because it was like their friends were losing teeth left and right. And looking at my kid and I'm like, what's going on over here? We haven't lost anything.
Gentle age.
Yeah. And it's really cool. So my friend who has a biological practice in Maryland, she's the one who did Lily's ALF. And so afterwards I was like, can we do another CBCT? I want to see the results. And she's like, I mean, we can, but we don't have to expose her to any more. Like, she's like, it's just a little bit of like radiation, but like, we don't have to. And I was like, it's fine. I want the hard data. I want to know that this worked and I want to see where she's at. And it's really cool because I have, I think, an Instagram highlight where you can see like her before and after. I put some of the before and after images next to each other where like you can see her sinuses are completely cleared in her nasal airway. And it's amazing. And then you can see the growth she got in her upper, palate. And you just see like the kid looks completely different. Her posture changed. Like she looks like a different child in the span of 9 to 12
That's
months.
amazing. I got to look up that reel.
Yeah, I'll have to find it, but
Having a good ALF provider is hard to find. Like I see, like you got really lucky to have a good friend who knows what she's doing. Cause I see
yeah.
some people are like in that thing for years and it's
Yes.
very
Yes.
technique sensitive.
Well, and because I know there's providers who will actually who say like they keep the kids in it until they're in their teens. They
Yeah.
start them young and they just change it out as they grow and put in a new one. And I was like, this is more of a stepping stone for us. Like, I'm not saying that I didn't know if we would need something else or not, but I was like, this is for the right now. Like, I know she's
Yeah.
going to grow and I know it's probably not going to be the end all be all, but for right now, how do we get her airway healthy? And, then we took it. And honestly, I think she was technically done after like 9 months, but it stayed in because of COVID. And we took it out August 2020. What was that? 21? No, August 2020. It was still maybe during COVID that we took out the appliance because we moved a year later. And so we never really went back anything because that area was still very, very shut down for a very,
Yeah.
very long time. Schools did not open at all that year. It was wild. But anyways, so yeah, I mean, it was just very cool. She was also training through the Alpha Education Institute with Bronson and family. And I think used Lily's case like as her case that she was, so I think there were other eyes on her case too, but I think she was also just an easier case because she was 4. So it was sort of like we
It
can
went
make
really
this little
well.
tweak. Wow, look at that huge difference that made kind of thing.
Yeah.
Yeah.
That's amazing.
Yeah. So I'm very grateful for.
Were you doing craniosacral work or would you have if you had not been
I would
during
have.
COVID?
I
Yeah.
would have. We did not because we just by the time like we were kind of getting into it and I figured out like who to take her to because it was actually really hard to find people in my area that were doing that.
Yeah, that's
I
very hard to find everywhere.
Yeah, so I did find a DO. They were a couple and they actually moved back and now they're moving away again, unfortunately. But
Oh.
the husband is like he's PT trained, but he's also a DO, but I think he was trained in Germany. And so whatever, I think his PT was recognized in the US, but not his DO. Whereas she's a trained DO through the US and they're a husband-wife team. And it wasn't until I had Mia and Mia was around a year old and she just was like dragging a leg behind her. This is my second one. And, feeding went well and her airway looked like it was okay at that point. I was like, but we're definitely headed towards some expansion. I took her to them and then I think they moved at that point. Anyways, they would go and teach in Germany and now her family's on the West Coast and they're moving to the West Coast and they moved back and they moved away. And so it was just, I took Mia must have been 13 months. She was not walking yet. She was not scaling furniture. She wasn't really even pulling herself up or anything. And we had been in PT on and off for like 6 months. And I was like, yeah, this is not really doing anything. And so I stopped it. I took her to a craniosacral therapist and then a week later took her to the DOs and within like the next day after the DO appointment. So I don't know which one it was or if it was a combination. She stood up and started scaling furniture. And within a week, she was walking. Like she also then after that was crawling on all 4s finally across our couch. And I was like hysterical. Like my husband's like, what's the big deal? She can walk. I was like, no. It's an unstable surface and she's crossing midline and everything is integrating. We didn't just skip crawling. This is huge. You have no idea how important this is. And so I'm like very, very thankful and grateful to them that the craniosacral therapist is still local. But yeah, so it's just been like one of those like really challenging things to find.
Yeah. I'm a big fan. We have 2 osteopaths here in Bozeman that are really talented craniosacral work. And I think it's really helpful to preventing those asymmetries and like just making sure everything's moving like it should be.
Yeah.
And they like are magical. I don't even know how they do it. Like they'll be like, "Oh,
Yeah.
your ribs are really tight right here." And I'm like, "How did you know?"
Yeah. Yeah.
And I was asking them the other day, I was like, "Dude, how did you learn this? Like, how can you feel that?" And they're I think they both told me like it took like 4 years and then one day it just clicked and I could start to feel it. I'm like, that is 4 years of like all of a sudden you're like, oh, I feel this.
Yeah.
And then I don't know how they do that magic, but
It's
I have
incredible.
like, I told you I'm doing the DNA right now and I have this suture here is really tight and hard to expand. And I can kind of feel like this side of my face is not expanding as nicely as this side.
Yeah.
And so I'm actually going today after this to go get some craniosacral work done. And I think that we have to like pair those things together really, like for an ideal case. Some people,
Yeah.
expand really nice, but a lot of us have like these imbalances where things are just not moving exactly how they should be.
Yeah.
And anywhere in the body, I'm like, obviously I'm talking about the head mostly, but like this craniosacral therapist has been helping my mom a ton with this leg pain that she couldn't figure out anywhere else. And so, I like the old way of thinking in dentistry, what I was taught is put a fixed retainer in because the sutures are closed and nothing moves. And
Right.
we were really wrong about that.
Yeah.
I like to point to this, like Elon Musk has that company where they put little electrodes in your brain to like help someone who's a quadriplegic
Yeah.
communicate. And they put them in and fixed them in place, like sewed them in, or I don't know exactly how they did it, but it wasn't long before the brain had, like, they were out of place by 2 millimeters because the brain had moved. And what they're realizing is there's like a pulse to the brain. Obviously, like every night, this CSF goes in and cleans up the brain, and we have that lymphatic system. And so our skulls are actually moving to accommodate also like a concussion or whatever. So what we thought was like this fixed suture is wrong. That's an old paradigm. We need to start thinking about the head as all having like a pulse to it. And so the craniosacral therapist can just make sure that all of that is moving and balanced like it should be. And so if you're doing like that kind of work at a young age and helping, like, I think that, like, to your point about how like suddenly you felt like the teeth were starting to fall out, I think we're getting the blood flowing again and like helping. I don't exactly know how to describe it, but we're helping create this balance
Yeah.
that we're supposed to have so that things aren't blocked up and locked in places.
Yeah. Well, and so the guy that I would see, Manny, he was a physical therapist by trade, but like not doing any like really traditional PT stuff. He had gone through PRI and he got trained there, but then he had done umpteen hours of like continuing ed and just learning all these different types of modalities. And so his business was unlocking your body. And and then also there was another PT that also had learned similar things. And I think actually now teaches for PRI though, that were both in the dentist's office on different days. And they both have their own practices and like would see you in between if you wanted to, like in their own facility. But it was just incredible. Like he would map things on my brain. Like he would just come up here and feel things. And he'd be like, oh, I got to go here in your body and do this. And he would like come over and push him like, ow, how'd you know? Like, I didn't even know it. And the craziest part was like, he'd be like, oh, your chest is tight. We need to like open the airway here too. And like, he would come here and do some work. Right. And I would be like, I had no idea, but like now I feel that tension released. And it was cool because like you said, everything was flowing. And like, whether it's like your blood or the lymphatic system, I could feel it pulsing in my body. And he was like, only about 30% of people can really like feel that when it happens. But he'd be like, do you feel that? Do you feel? I'm like, yes, I do feel like things are flowing. Like what? And I would walk out of there feeling like I had this full body massage. I'm like, he barely touched me. Like, but
I know it's magic.
It's absolute magic. And like I said before, like I could not crank my appliance sometimes. Like I could not turn the DNA key. Like I could turn it. It wasn't going in my mouth. And I would see him. And then it was like I could crank it like 1.5 times sometimes. Like it was not that I was cranking it that fast, but it was like, holy cow, I clearly am like, this just tells you everything was so locked up, so tight. And now that everything is like flowing again and speaking to each other and the suture lines are able to, do what they need to do, now we can continue to move forward. And that was like, that really became super noticeable about a year in. And again, I was in this for 2 years. So about 50% of the way through my process.
Mm-hmm.
But it was eye-opening to me. And then I started telling all my patients, I was like, I can't explain it. All I know is that you need some body work and we got to find somebody. Because the thing is, he would work with like teens on up, but not like younger kids. And so it was still really challenging to find someone. And I know there are people now down here in Boca. There's actually somebody that I've been wanting to like take the kids to because she's supposed to be phenomenal. She does CST. And so I need to get on that because I think it's just good for everybody to have regardless of expansion or not. But yeah, it's incredible.
I take the kids to those 2 doctors here and I find that it's really helpful with like all kinds of little aches and pains that they have from skiing or I don't know.
Yeah.
I don't know what happens to them, but sometimes they'll just have like growing pains or whatever. And or a post concussions. My boys have both had a bunch of concussions, unfortunately. And they're just wild. I don't know what they're hitting their heads on the playground on pipes.
Oh my goodness.
I'm like,
Boys.
what are you doing? But yeah, I found, so because I think I was a mouth breather forever, I think my apnea turned into this autoimmune disease, which is a spinal arthritis, due to like just my body being overloaded with too much stress from all those things together. But I get a lot of pain through here and in my ribs. And so when I get craniosacral work, he's always like, oh, your ribs are so stuck. And he's like, you need to just start doing like deep breaths and trying to expand into them. So I've been doing that laying in bed at night, just like not long. I mean, honestly, I'll fall asleep. Probably it's like a minute of like deep breath here, deep breath there. And I can feel it changing. And I think I was just like super locked up because I wasn't breathing with my diaphragm for all those years. And I really wasn't taking deep breaths. And I was kind of just doing this shallow mouth breathing. So it's funny how that is all related, and that diaphragmatic breathing is so important to moving the lymph. It's kind of like pumping the lymph in the body, which is probably why I always had, throat infections and stuff. And so, this is why I'm so passionate about this field. Like it all like circles back to becoming this like big picture, really life-changing work.
Yeah. Everything. I always go back to like, aside from the fact that I say we're connected from the tip of our tongue to the tip of our toes, I'm like, it's just everything impacts everything else. It's such a domino effect. And I feel like I had a lot of that too. Like I had strep throat. I was prone to strep throat growing up. And I was definitely like, when I look back at it now, like you're saying, like I was breathing from my like clavicular area. I was not breathing from my chest even. It was like so high up here that it was so short and, not from my diaphragm at all. And very interestingly, with my second pregnancy, like I had an injury. But at that point, I was breathing better because I'd gone to Manny between kids. And he was like, oh, no, we're going to prep you for your next pregnancy. And I'm going to continue to see you so that we make sure that you're breathing properly. Because it just made everything so much harder when you have a baby pushing on the diaphragm and you're already not using it properly. Hello. So I was much more comfortable in my second pregnancy, but then I was over stretched by a chiropractor and I had a like rib injury from that. And I noticed with my breathing, like how like it kind of sent me back into more shallow breathing because of not wanting to expand the rib cage with a baby pushing on it. So anyways, I had to then work through it again to get back, after the injury was healed, to basically move back into that deeper breathing again. And it was such a focus of my second pregnancy. And I don't think I've really talked about that much. I didn't really think about it now until you even brought this whole thing up. But that's one of the things.
What did you do? How did you get your breathing better?
I mean, I was just focused on deep breaths. I was focused on deep breaths. I was seeing Manny. I switched to a different chiropractor that I saw in my first pregnancy that was less holistic, but didn't injure me. And I went to the first one because one, it was covered by my insurance initially. And I was having trouble getting up off of the floor because I was in pain and I was working with kids still. And I was sitting on the floor working a lot of like little toddlers and 3-year-olds and 4-year-olds. And I was like, I can't get on the floor and I can't get off the floor and I barely can go up and down the stairs. I'm in so much pain. And they're like, it's not sciatica. I'm like, I think it is. But he fixed me in like 3 sessions and adjusted things. And so I really liked him, but in my brain, I'd gone like so holistic, like at that point. And so it was like hard for me to even go to this practice. So I wanted to go to the holistic one that was down the street from my house. I was like, this should be the place I go. And I just had a bad experience and, neither here nor there, but I ended up switching back to them. And between them and Manny, my PT with the PRI training and all the other stuff, the two of them, like he gave me some breathing exercises. He would give me like a balloon and I don't even remember what he had me doing, but he was like, I want you to do this. So we keep the chest expanded and we're not, things are not tightening up. And we just really worked on chest expansion and deeper breaths, even with that baby, hanging tight in there. Yeah.
I feel like I like to have like a coach and some kind of routine, but it's not necessarily even that complicated. Like me laying in bed, literally doing 10 deep breaths and like really kind of let's feel it on this side, then feel it here, then feel it, That's like all it's taken to just loosen up my ribs.
Yeah. 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 Well, and that's, one of the first things that we look at on a myo eval, kids too, but especially like a lot of the adults, you can see it so easily on the adults is where are they breathing from? Are they breathing from their clavicle? And you can ask, and sometimes kids will point. They'll be like, I feel it here. And they can feel it in their chest, and you don't see the belly moving. So, they're not doing that deep belly breathing. Right. But it was always so fun, like to teach a kid how to belly breathe. Like we would like lay them on the ground and put something on their belly and be like, let's see if we can make this fall off. Right. And just something silly where it's like, fill that belly up. Let's make it like a balloon. And, the thing would fall off and they would think it was so funny. And, it's literally just telling them to inflate their bellies, like breathe here instead of here. Yeah. So yeah, I think it can be so simple. It doesn't have to be complicated at all. I think it's just half the issue is just bringing awareness.
Yeah, I feel like that too. I see that with patients all the time where I'm like, well, think about this. And then they come back and they're like, dude, I thought about that for 2 weeks. It's a thing, and you're like, all right, what are we going to do? Let's work on it, and it just awakens. I'm sure with kids, like it's so much easier to get results, how much breathing stuff do you guys do some Buteyko? Like what?
Yeah, we definitely use some Buteyko. Like I'm not treating right now, but my team will use that. One of the mentors inside, so I have the Myo membership and I have like a Myo course and Myo certification.
Yeah.
One of the mentors inside our membership is like Buteyko trained, certified, whatever she is, Caitlin. And so she definitely implements the Buteyko stuff all the time, like in her recommendations too. So yes, 100%. Love Patrick and everything he teaches as well.
Yeah, cool.
Yeah.
Can you tell me about some tongue tie stuff? Because I feel like I lean on the myofunctional therapist a lot for that. I just tell patients like, look, they're going to tell you if you need it and when. I'm going to wait till like you get like a plateau in your, progress, and then we can talk about getting it done.
Yeah.
And then it seems to me like there's like kind of like 2 good times to do it, like right at birth, and then, maybe when they're older and they can tolerate the doing myofunctional therapy and the whole process around it. But what are your thoughts about timing?
So as far as ages go, like I think what I've seen is like certain providers prefer like certain ages sometimes, but we'll do any age.
Okay.
Yes, I think it's totally easier when they're an infant, like a young infant, especially like under 5-6 months of age. And then obviously if they're older and we can do like more traditional myo, like 4, 5, 6, that's going to be easier than like your 2 and 3-year-olds. But a lot of times our providers will like place a suture or a couple sutures in like a toddler's mouth so that we don't have to worry about like them being non-compliant and it healing on itself.
Yeah.
Either from like an active wound care standpoint with the parents, getting in there and or the myo exercise side of things. But like optimal timing, like my rule of thumb is kind of like what you said, right? First we'll intervene and try, to do therapy. And if we're hitting a wall, we're going to have that release consult. We're going to recommend, they go for the consult. Oftentimes, like in my practice, at least, a lot of these kids within 3 to 4 sessions, so like 3 weeks on average, we know if we're going to move forward with, if we think we need a release or we don't, like we can't say they need it, but we're referring forward. And we typically are not referring unless we believe that it's needed. So our like referral providers know like, hey, if they're sending them, like
it needs to be done.
Right. So there's that side of it. The other side of it is like, we don't love them going in and having it done like same day. We like to like really prep the family, like have them do the consult first and then set a time, make sure the child and family is truly ready, because so often we see a lot of these families that are not properly prepped and they're kind of like freaking out afterwards. Like, I don't want to hurt them, or I don't know if I'm doing this right. And we're like, well, you should have known all that before you had the procedure, because now is not the time to figure that out.
Yeah.
That's not fun for anyone. And then body work. Like one of the really big things that early on in my career, we did not recommend, or like, not that we require body work, but like we really encourage families to get body work surrounding the release before and after. And like, yeah, the work that we're doing is going to help, but we see like the CST or the osteo or whatever, is happening in terms of body work around that release. We see huge differences in outcomes. Like I can compare cases earlier on in my career to when we then started saying, hey, we think you really should have this. and the way that the body responds, plus the way the child heals, the nervous system, like for the child and the parent, it is like night and day.
Wait, what kind of body work specifically are they doing?
So just craniosacral therapy, or
Okay.
going to see the osteopath,
Yeah.
or maybe they're working with a chiropractor, but like most of the time we're recommending CST or the osteopath because that's very like hand in hand kind of
And do you think
similar.
that's just because the fascia is like
Oh yeah. I think the fascia is way
down
more
to the toes?
pliable. I think it's easier for the release provider to release the tissue and to know that like we had a like complete release.
Mhm.
If we do have to suture the child, I think that the tissue is just more pliable and it's easier to suture. And as it heals, I think it heals better. Um, I feel like when the child is healing because the release was better, not that the release wasn't good if we don't have CST, but like I just feel like because things were more pliable, like it just makes it easier. Like we're more easily able to make gains quicker.
Mhm.
And again, we see kids who are not like in this tense, it's like if you're not getting the body work, we see like a lot of tension patterns held. And then you go into a release with that tension. You come out of the release with that tension, maybe plus more tension. And now we're trying to get you to move your tongue and it hurts. Like,
Yeah.
yeah.
See, we're just back to like this is all it's not an isolated system,
Mhm.
like
Yeah. And
and
I notice a lot of the feeding struggles that some of the kids have too, where like babies are swallowing too much air. We have this aerophagia going on. It's like the tethered tissue on the like floor of the tongue, right, is connected indirectly to the hyoid. So we're then pulling the hyoid up and forward, which is impacting how we swallow. We're swallowing too much air. That causes dysfunction. That causes discomfort, in the digestive tract. It's just, I feel like it's just this whole like snowball of issues. And so
Mhm.
if we can kind of get everything to relax, then maybe we're not doing that as much. Maybe we're at least relaxed. I'll see kids go in for body work and the families don't want to release. And we'll see that like the body work doesn't hold. Like they have immediate results. And then like within a couple of days, it's like gone. And that's part of the time we're like, well, function is clearly impaired beyond the mouth. And that's our biggest thing for also determining one, if it's a tongue tie, and two, if we think the release provider should be seen, like form and function, right? So it's not just that we see a tight fascia present, but function is impaired and function is maybe slowly improving, but like we're hitting that wall like we talked about.
yeah.
Yeah.
So, do you think that there's an increase in tongue ties because of the folic acid stuff or do you think that we're just diagnosing them more? Like to me, people ask me that all the time. I just want to get your take on that.
I don't know. I mean, honestly think it could be both. I think epigenetics, right? So I do believe that the whole like apoptosis is not happening in the same way that it should. And I think that obviously there's a genetic component and I think there's an environmental component. I think it's completely both. I think,
Yeah.
yes, we're better at diagnosing them, but like they've been present for a long time. So is it that there's more? I do think there are more tethered tissues. And I think that our jaws are shrinking. I think there's
Mhm.
other components. So I don't think it's just the ties. I think it's part of like a bigger puzzle where we know our jaws are shrinking and we have this tight tissue and we have other tension patterns in the body. I think that it's just kind of snowballing in a way that we can't compensate as well as maybe we used to. And so now it's
Yeah.
a bigger issue that we need to address.
Yeah. Have you heard that study about in Brazil, they require every child to have a tongue tie evaluation before age 6 months because
Yeah.
at age 70, the people with severe tongue ties had severe health issues, moderate tongue ties had moderate health issues, and mild tongue ties had mild health
I
issues.
love Brazil. They always have the best tongue tie research coming out of there.
I mean, it's amazing. Like, that just speaks again to this. Like, it's not just the tongue. Like, this
Yeah.
whole system is all connected. And,
And they've been
it's
doing
getting the
those like
proper.
newborn screenings for tongue ties for a while too. I've been like talking like the US really needs to get on board with that.
Yes. I hear there's some hospitals that don't even let you say the word tongue tie. Like,
Oh
it's,
no, such gag orders. It's crazy. So what's interesting? The hospital where I had my kids is a very like room in mom, baby friendly, breastfeeding friendly hospital. They will not give your child a pacifier. Like you can give them one, but they're not offering that. They will bottle feed and everything. They'll also take the baby to the nursery if you want them to. Otherwise, it's like kind of assumed everyone's rooming in, right? Really high ratings, even for hospitals. Like I know hospitals these days, people look for different ratings on like maternal things as well, like really highly rated. So I remember with Lily, I had no idea because I wasn't in this world yet. That was like to come like a year later. But with Mia, who was born in February 2018, I was like, I'm not going to look. I'm just going to blissfully ignore it for at least the first 24 hours. And the second I latched her, I was like, dang it. It's like, this feels like Lily all over again. Like, I don't even need to look. I know. And so, of course, I look and I said something to the charge nurse and she was like, oh, I don't know. Do you want us to send somebody in to help with breastfeeding? I was like, yeah, send them in, whatever. The second my pediatrician showed up and agreed with me that the baby was tongue-tied, would you believe the nurse in the room was like, do you want our surgeon to release that for you? And I was like, oh, get the F out of here. I was like, absolutely. No, you are not touching my baby. I'm going to the oral surgeon that did my other child and that did my tongue. Like, no, don't touch my baby. But I was like, how interesting that y'all couldn't diagnose and you didn't want to even acknowledge it until an outside source diagnosed it. But now you want to bill my insurance and do the release in the hospital. Okay. I got it. Got your number.
I think that's very standard.
Mm-hmm. Oh, yeah. Yep.
Yeah.
Very standard.
It's just the way healthcare works now. So
Yeah.
I don't know.
Yep. No, I was like, I got my people, so don't touch my kid.
Yeah, I would say if you're having a baby soon, just find your local expert and get it evaluated.
Yeah, totally.
I'm all about like staying home, not leaving the house for like 6 weeks and having everyone come to you, but that one might be worth going out for.
Yeah. Well, I mean, and you can have sometimes like a lactation consultant who's an RN. Because they're an RN, I think they technically can diagnose it. And some states, SLPs or OTs might be able to diagnose it. Like I could in Maryland, I can here in Florida, but I know New York and New Jersey, I think you can't. So it's just like state by state. So yeah, if you can find somebody who can at least help you diagnose it, and then you can go to the release provider for like the next step.
Yeah.
Yeah. Yeah. It's wild. It is wild.
I'm like bullish on them because I feel like it helps with jaw development naturally. So if you can just like go through that one little procedure and you're going to nurse better and they're going to develop more naturally, like the jaws that they were meant to have, I think it pays off.
Yeah. We've seen like huge changes in like the lower jaw coming forward when there's a tongue tie release that needs to be done, plus like craniosacral therapy. And maybe you're working with like somebody to help with feeding if that's needed. Really very cool to see like that lower jaw. Like you see the baby photos and you see like photos a couple weeks later and that jaw is already coming forward. And you're just like, see the fascia, that release just allowed for the jaw to move into place. Yeah.
So awesome.
It's very cool.
Yeah.
But anywho, I know we could chat all day. Is there anything else we haven't covered that you want to talk about?
I feel like we've talked about a lot of good stuff.
We have.
Yeah.
All right. So tell us where they can find you.
I feel like if you're on Instagram, that's a really good way because it also has like my link tree with my website and our pediatric screening questionnaire, the adult screening questionnaire. So it's a good way to kind of like get some data right through there. You can submit photos, fill out the questionnaire, like set up a Zoom, or sometimes I can just like do a video for you and tell you what I'm seeing in the pictures and the questionnaire. And yeah, that's a good place to start.
All right. Well, we'll make sure that is linked in the show notes so they know where to find you. And thank you for joining me today. This was so much fun.
Yeah. Thanks for having me, Hallie. This was fun.
Thanks for listening to this podcast. If you found value in this episode and want to hear more of these MyoTots airway and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBalkin.com or pop over to @HallieBalkin on Instagram to get all the latest updates.